deans for the School of Nursing. And so I don't know if that just pops up for me or everybody else, but this event is recorded so that you're aware of that, and we can actually share with those who originally wanted to attend but weren't unable to do so. If you could please mute yourselves and keep yourselves muted unless you have a question to ask. And there were a handful of pre-submitted questions that we'll address at the end. At the end of the event to address those, but I think several of those will be covered in the comments that our associate deans will be making. So I do want to just take a brief time to introduce you to our associate deans, and then each one of them is going to be addressing what they feel are the top 2 to 3 priorities for their area of responsibilities over the next 3 to 5 years. So the first person who will be talking will be Renu Singh. And Renu serves as the Senior Associate Dean for Finance and Operations at the School of Nursing. And she's the CEO of the University Rochester Medicine Employee Wellness Program. She has over 25 years experience in academic and clinical healthcare delivery systems. Her innovative leadership led to the successful development and implementation of a corporate wellness program that now provides preventative health services throughout the community through direct contracting with numerous businesses in the region. And I think if I'm not incorrect, that we're serving at least 54 corporations now within the Rochester community. I will introduce to you Sally Norton, but she's unable to be here today because of a death in her family. There was going to be another researcher take her place, but she has COVID. So I'm the third stringer. And so, I will be sharing with you what Sally was going to talk with you about in relation to her priorities. But Sally Norton is our Associate Dean of Research. She's a nationally recognized expert in palliative care research and qualitative and mixed method research design. She also serves as co-director of research for the Division of Palliative Care in the Department of Medicine at the University Medical Center and holds a secondary appointment at the School of Medicine and Dentistry. And then we have Lydia Rotundo. The education mission is led by Lydia, who was named Associate Dean of Education and Student Affairs in 2015. And she also serves as the director of the school's DNP, Doctor of Nursing Practice program since 2014. Lydia is a nationally recognized leader in DNP education and is a champion of nursing education reform for the 21st century healthcare. Under her leadership, there has been strategic investment in expanding education technology and experiential learning and developing an academic innovation infrastructure. Mitchell Wharton is an associate professor of clinical nursing and is the associate dean of equity and inclusion. He's the newest member of our senior leadership team. They are a 2013 alum of our PhD program. Nationally, they serve as secretary for the American Association of Colleges of Nursing and DEI Leadership Nurse Network and president-elect for the Association of Nurses in AIDS Care. So welcome to all of you. So the question I asked each one of them to address today was, what do they feel are the top 2 to 3 priorities in their area of responsibility over the next few years? So Renu, I'm going to let you take off first.
Thank you, and welcome everyone. I'm really excited to share some news with you today and really share with you what our strategies are in the next couple of years. I will share that we are now up to 58 organizations, Kathy, and I meant to mention that to you this morning. By the end of last week, we had officially signed 4 more organizations, and so we're very excited about that. I think that number is going to continue to grow as people are kind of getting back into the workplace, and we had a couple of years of a lull there with COVID, so it's exciting to be back on that path of growth. So over the past 6 months or maybe a year, we've really looked at what are our strategic initiatives moving forward, what's most important for us to focus on. We've spent a lot of time over the last several years really aligning our organization to easily apply our model and operationalize our program in any type of an organization, whether it be small, medium, or large, whether it's labor workforce or legal office. And we've really gotten to a point now where we can tell you definitively that our outcomes, and that is our clinical outcomes, have been able to be sustained and duplicated in various industries. And so we're very proud of that. And so our overarching goal, kind of in alignment with that, is to really be an exemplar of outcome-driven wellness and prevention in our nation. And what we know is that we have, through our published outcomes and those of other organizations, wellness driven organizations, our outcomes really are unrivaled. Like we have, we really are in a good place to become national leaders and to be visible from that perspective. And so that's our overarching goal. We have several strategic objectives that we want to achieve. The first, of course, is expanding our footprint, which I think we have. We're starting again to be able to do that. We really want a good hold in the Rochester region, and then we want to expand in the Syracuse and Buffalo area. And so, and that is our initiative to take a model that we know is working and that's effective, and to bring in as many individuals into the fold so that we can have the biggest impact possible. I think along that lines, and this is something that we're most excited about, we are ready now where we feel that that because we have a very we have a good hold on what our outcomes are, and we're well adapted in all communities and all with all populations that are within the working well, I'll call them, because we work primarily with organizations and industries. We are now looking at how we can immerse our program directly to the community, and really directly to in vulnerable populations where our services are most needed and they are not available because of the way that our programs are contracted. Our programs are contracted direct with organizations. They are actually paid for by insurance companies in many situations. In fact, most of our situations are covered by third-party reimbursement, but they're contracted for only through organizations. And so with the help of leaders in the medical center, including Kathy Paranello, we engaged in a pilot program in the last year, specifically with Jordan Health. And we're really, we're partnering with their primary care providers to identify those individuals who have a chronic disease that that we can work with and help to improve their lifestyle and the management of their disease, and see if our outcomes also can benefit that population of people who right now don't have access to our services. So one of our strategic goals is to really enable that to happen, and that's going to take a lot. It's working with payers to make certain that that we're available outside of even the corporate infrastructure, and that we can be available to individuals or as covered services on our own directly to the community. So we're working alongside with our payer partners to see if that can happen while we're also piloting our program at Jordan Health. And I will tell you that so far things are going very well. We have we've been in the community now for really only 6 weeks, and during that time we have 24 people enrolled in our diabetes program, and that is one of the major issues in the community right now. It was what was identified by Jordan Health providers as their top area of need, and so we're very excited about that. So that is a primary objective. Another, I will tell you, is building payer payer relationships and employer relationships, and really not just to drive business into the organization, though that is always a wonderful byproduct of being, dare I say, good at what we do. But we want to also build awareness in the community, because one of the things that we've learned while we've been in the community is that not all programs are equal. Not all programs that call themselves employee wellness programs can provide the program in a comprehensive and coordinated manner that can achieve the results that we have. So one of our goals is to really educate the community on what it is that they need to look for in programs, and on what it is they need to assess program success with. And to continue to do that on a national level through publications and through presentations. And so outside of that, the last thing I'll mention is really what every strategic plan has to have, and that's really to ensure that we have a streamlined set of resources, that we maximize our program benefits and optimize all of our efficiencies so that we're able to provide services to everyone who needs them. So that's it in a nutshell.
Thanks, Renew. I'm going to move people along so we have time to ask questions. You can ask Renew questions when each are finished presenting. Lydia?
So thank you. I'm thrilled to talk to everybody today, and there's so much to share within education that I'd like to start off by saying in terms of priorities, I'll start by saying nursing education is really undergoing a sea change in terms of curriculum, and it's part of a larger movement within health professions education more broadly. But essentially, nursing education is really embracing the competency-based education movement, which basically shifts our focus from what students or graduates know to what they can do with what they know. And so it's much more thinking about application or integration of knowledge and skills across multiple contexts. And so that has significant implications for us as it relates to how we teach, as well as how we assess learning. The other piece specifically within nursing education is that and again, in alignment with the competency-based education movement, is that the Nclex, which is the nursing board exam, licensure exam, is changing. The blueprint is changing. It's going to be launched next April of 23. And similarly, it is moving away from facts or just knowledge base, and much more focusing on questions that require critical thinking and clinical judgment. So students will have a case study with 3 to 6 case studies with embedded questions that they have to continually apply. So this has created for us a really important foundation from which to think about nursing education in a different way. Fortunately, we have been planning for this. We have been, for the past several years now, we have been looking at creating opportunities to think about nursing education in a reimagined way, from the point of view of leveraging technology, from the point of view of expanding and experiential learning. And I would say that, the second priority, or in response to that, really that top priority, is to fundamentally re-examine or continue our efforts to employ transformational teaching and learning. And what I mean by that is we are, as evidenced by the new ribbon cutting that we just had on Friday, it was super exciting to see the 26,000 square foot addition to our education wing, the vertical expansion. And it's in a building that's entirely based upon this philosophy of experiential learning and engagement. So in order to allow our students to think about themselves in a new way, or embrace this new way of thinking, we have changed how we're teaching them. So for example, we don't have our faculty just lecturing. Our faculty is very active learning. The students work in small groups. They do work on their tablets. The undergraduate program is tablet based, and we refer to that as our IROC program, Redefining Our Classroom. We've been working on that now for a few years, and just this past fall, As many of you know, we were designated as an Apple Distinguished School. So we are thrilled to really fully leverage technology to help us provide the kind of education to our students that allow them to be, adaptable systems thinkers, to have them look at themselves from a point of view of working in team-based care. So how are they collaborators? We also it has allowed us to look at the environment the learning environment in a much more expansive way. So we're talking about a face-to-face learning environment, a digital learning environment, the clinical learning environment. And so what we've done is, through this approach, we're really sort of removing boundaries between what is classroom, clinical, lab, and really sort of have this integrated experience where we're able to utilize technology as well as simulation to help put our students in clinical scenarios where they will be applying what they're learning. They will be looking at it from the point of view of a member of a multidisciplinary team and take those different vantage points. So that whole segment of how we're teaching is really part of our larger strategic plan to become a national leader in academic innovation. And that will be the mainstay of our work for the next few years. I'll just highlight a couple of sub objectives within that, because they also are really important to us. The first is that we hope to build a center of excellence for academic innovation that will not only house the various infrastructure that we have in academic innovation. For example, we have a simulation team, we have an educational innovation team, which is really about instructional designers. We have close relationships with our IT who help us with these different elements. So we have our mobile learning program. So all that internal structure, but we also hope, similar to Renew, to be a national leader in nursing education in this transformational space. And so we hope that our academic center of excellence, innovation center of excellence, will also have an external facing where we can be a resource just to other schools. We already are that as an Apple Distinguished School. We actually meet with or called upon to be a resource to others. And many of our faculty are asked to lecture at national nursing organizations as well for the kind of work we're doing. So that's a really exciting, that's a little longer term, but we hope to build to that. And then just within another couple of points, is one of our real areas of focus is to look, in terms of our innovation plans, is to really look at interprofessional education. That is something that we know is critically important, not only interprofessional education, but really to speak to what I was mentioning before, this idea of innovation, interprofessional collaborative practice, and all of our efforts are focusing on that. So that will be another part. And then, of course, we will continue with this transformational teaching and learning as it continues to evolve. And then lastly, it's really important that we disseminate. So we really are ambitious in terms of applying for educational grants, also thinking of other sources of external funding, pilot studies to continue the work we're doing, and then also disseminating through publications and presentations. So I'll just end there and wait for more questions later.
Great. Thanks, Lydia. I know there are some questions popping up in the chat. Sometimes the answers are being given as they're popping up, which is good. And I promise you, we will get to some of the comments or questions at the end of the opening remarks from our associate deans. Mitchell.
Excuse me. Hello and good afternoon, everyone. It is such a pleasure to be here with you today. As you may or may not know, we recently revised our unification model. And one of the highlights of that unification model revision is that our three primary missions of education, research, and practice have now been reconceptualized so that we see not just the integration of each amongst one another, but we also see it through a lens of diversity, equity, and inclusion. And that's something that I'm thrilled to see that we are progressing forward with. So some of the priorities that I have as I build out the Office for Equity and Inclusion and Belonging here at the School of Nursing are first and foremost for us to establish a common baseline of what is meant by DEI. This is a term that's been thrown around a lot in terms of not just social media and in the world that's happening around us, but even within the nursing sphere. And so with that,
bye.
I'm just going to
go by Janet. I go by either one.
Yeah. Can I just remind everyone to mute? Can I just remind everyone to mute themselves? I don't know who JS8477 is, but would you mind muting yourself, please? Thank you. Okay.
Thank you so much. as I was saying, we see DEI as a buzzword in a lot of places. However, I don't think that we always have a solid understanding of what is meant by that term. And the roots go far deeper than simply performative stances or simple metrics of how many of one person or one type of person does an organization have or not have. And so as we think about the full integration of what DEI looks like here at the School of Nursing, again, we start with that basic common language and really start focusing on the contextual factors that really make up DEI. So thinking about things like health equity, thinking about things like social justice, how do they impact not just the students that are coming to our programs, but as they're learning and as they're exiting our programs and entering into the workforce, what is the impact that that's going to have? DEI is not a stationary concept that you just learn about and read about. It is something that you actually practice. And so thinking about how do we practice and how do we integrate that? You earlier heard Dean Rotundo talk about a lot of the new innovations that we have. How do we make sure that we integrate that? And one of the great features that I'm proud to see is that we have integrated that beautifully in our simulation mannequins or high fidelity simulation mannequins. And there are also experiences where we can integrate that throughout our virtual reality learning. And so as we think about that center of excellence, part of that center of excellence is how do we not only excel, but advance DEI concepts throughout there. You also heard Dean Singh talk about our interactions with the community and making sure that people have a firm understanding of what wellness is and what a quality wellness program is. Well, a huge concern or a huge part of that is also making sure that we understand our community and that we understand what the needs of the community are. And so from an educational standpoint and both from a practice standpoint, making sure that we have a solid foundation in terms of who do we represent, who are we trying to bring in, and also who is missing from the table. So those are some of the basic foundational things when we start to think about the common concepts that bring DEI together. We can also think about common language. And so what does it mean as we start to use different words and different phrases? The AAMC, American Association of Colleges of Medicine, recently put out a paper talking about language and how it's effective or ineffective in representing different groups. But that's very confusing for a lot of people. It's a huge shift, not only in terms of lay language, but also in terms of the research language. And so one of the things that we're working on, not only here in the School of Nursing, but also across the university, is redefining not redefining, but helping people to understand what that common language is and how it should be utilized so that we're honoring people in the best ways possible, but also not just honoring them, but truly understanding what is the context in which they experience health and wellness. Now, for each of these, we can also do a deeper dive into each of the primary missions. So as we think about education, AACN has just created their new essentials, so learning essentials. So as we move forward, how are DEI concepts, particularly health education, but health equity utilized throughout those courses, and how do we structure and scaffold learning so that it's not a one-time thing in a one-time class, but again, understanding that everything that we teach has an impact, and that is what we're going for. That is what our primary objective is. With regard to research, the National Institutes of Nursing Research recently put out a revised strategic plan, which focuses heavily on health equity as well. And so one of the huge things that we've noticed is that researchers from underrepresented backgrounds have traditionally not been funded at the same level as white or Caucasian researchers. And primarily a lot of this is because the type of research that they're doing or the populations that they're researching on have not been funded. And so this is a shift and an opportunity to really try to move us forward to experiencing not only greater equity in terms of who gets funding, but also those projects and who those projects serve and service as we're moving forward. And then with regard to kind of our operations, we also need to think about our recruitment and retention for the workforce. So that's all of what this is talking about. You know, I think we do a great job here at the School of Nursing when we think about the students that we pull in. Our undergraduate recruitment, not undergraduate recruitment, our recruitment of underrepresented groups is about 22%, which is higher than the national average of 19%. Our recruitment of males is 17%, which again is higher than the national average of 9%. but we can continue to do better. We can continue to move forward. And so as we think about our admissions processes, and we do have a holistic admissions process, but also as we think about how we're recruiting folks to work within the school, either in our Center for Employee Wellness or other aspects in terms of our faculty and our staff, again, thinking through and making sure that we are aware of any biases that we have, figuring out strategies to mitigate those biases, lessen them, but also make sure that we're recruiting the most diverse workforce or diverse talent pool that we can. And that's not just about race or ethnicity. It's also about gender, it's about age, it's about lifetime experience. And with that, I will pause.
Thank you so much, Mitchell. And I will share with you briefly what Sally Norton has sent to me. We are really very fortunate that we've had a couple years of very successful recruiting in our research mission, particularly in the rank of assistant professors. So we now have 11 assistant professors that are part of our research faculty, our tenure track faculty, 3 of which will be joining us in July. And so this gives us an opportunity to really begin to grow each of the core areas of research focus that Sally Norton and her team have really emphasized. And I will share with you that they are really as a group looking at 5 different areas of research focus. We continue to say that we are a small faculty, but we are mighty. We did reach a rank of 23 this past year, which is really significant for the size of our faculty. The 5 areas of the research focus areas are healthy aging, maternal child health, cancer and palliative care, and one of our cancer researchers is on. I see Dr. Megan Underhill-Blasey, HIV, prevention and sexual health, and healthcare disparities, which really transcends, just as Mitchell was talking, each of those research core areas. And as Mitchell had shared, the NINR strategic plan was released last week, which our faculty did have input into that. It really does go very nicely with what our research priorities are. And so Sally's goals over the next couple of years, or priorities, are to really recruit mid-career faculty in those core areas that I've talked about. We have our younger faculty that are definitely going to contribute to each of those areas, and we've identified faculty in each of those areas for them to have mentorship from. But we definitely need to really increase our mid-career faculty, which is really a challenge nationally to recruit associate professors. And so that really is one of the priorities that Sally has identified. Also, she is looking to really look at cross-core program grant opportunities. So cross-core meaning across those different priority focus areas. So really combining healthy aging and health equity, healthcare disparities, and looking at what are some of the synergies between both of those areas and looking for grant opportunities to address those. She also wants to strengthen the integration of the social determinants of health into all of their work and increase focus on health equity, which is really where Mitchell's area will really be very instrumental in working with our tenure track faculty and our grant applications to ensure that we are looking at the social determinants of health, which is key in the NINR strategic plan, and really to ensure that we are addressing health equity in all of those areas. And her third is really to leverage our strengths of each of our missions to increase our expertise and work in implementation science. And this is where Sally Norton is working really very closely with Lydia to look at our integration of our DNP students with our PhD students to really strategize how to have them work more closely together to ensure the implementation of the research that the researchers are working on to ensure implementation into our clinical areas. So I know Sally would have talked much longer about her areas, but I think that it gives you an idea of where she is focusing over the next few years. And I will look now at the pre-submitted questions, which I think several of them we've already addressed. Lydia had already really addressed the changing educational preparation and the different areas that she is working on. There is one question that says, with the local and national workforce impacted in so many ways by the pandemic, are employers more motivated to work with the university for employee wellness services? And so Renew, I'll let you talk a little bit about that, but I also see that Sue Blakeman is on too, and she might be able to address some of the wellness initiatives as part of her strategic plan. But Renew, I'll let you take that, as well.
Sure. Absolutely. And the answer is yes. It is so much more visible to employers today, because it's not just you're looking at cardiovascular disease risk, which is a lot of the focus had initially been with employee wellness, but it's also emotional health, stress, all of the factors that have such an impact on employees. And so and really, we've just been through COVID and a cultural shift in the way that organizations are operating, and individuals, if you look at the workforce and the difficulty with recruitment and retention, all of it has been a big shift in our environment, and employers are paying attention. They have to, and they are, and they're very much engaged in wellness and coming up with strategies of how to provide employees with the environment that they need to thrive. And I think that might be a good intro for Susan as well, who's focused on our environment here at the School of Nursing.
Thanks, Renew. And I see that Caroline Nestro is also on as well. And Dr. Caroline Nestro and Dr. Susan Blakeman are co-leading our wellness goal, which is part of our strategic plan. So Susan or Caroline, I don't know if you want to jump in here. I'm actually putting you both on the spot, but that's okay. You're professionals.
Sure, we've been on this spot before. Caroline, please join me. Thanks so much. I mean, it's just one of the updates is that much like diversity, equity, inclusion, thinking about looking at an entire culture and how do we think about wellness across the culture of the School of Nursing. So wellness is one of the strategic planning goals right now, and thinking about how do we tackle all of those things, as we know that it's been so difficult for all of our communities in managing their own wellness. How do we think about that as faculty, as staff, and for the students that we are preparing to work in very difficult environments? So that's really been an emphasis. I certainly let Caroline add if she has anything to add. I wanted to just make a quick comment about that question about research around maternal child health, and just to note that we do have a HRSA grant right now at the school that is focusing on child molestation trauma. And so we are preparing 100 psychiatric mental health nurse practitioners across the state to really be thinking about that in all of their communities, how trauma is impacting us as a population, and how we need to really be thinking about using a trauma-informed lens in all that we do. So there's really important work happening that we're really privileged to be a part of, because we need everybody to be at their best in order to do that, to face the challenges that we have ahead.
Thank you, Susan, for addressing that question in the chat. Caroline, do you have anything else to add to what Susan was commenting on?
No, not at the moment. I think Susan covered it all, and I'm here to just really help move things along as quickly as we can, because wellness really can't wait for us to take our time with.
Thank you. This is sort of fun. I'm putting all kinds of people on the spot. So the next person I'm going to put on the spot, actually, one of the questions was, are there any new trends among the APNN students as a result of the pandemic in terms of their career paths? And do any of us see an increased interest in faculty or leadership career interest? And so I'm going to put Lisa Brophy on the spot if possible. You know, I will say that there are obviously always significant opportunities for our graduates in a wide variety of areas. I don't think if I have seen an increased interest in one area over the other, but Lisa, I will see what your thoughts about that might be. Lisa is our Assistant Dean for Education, but she had for many years been the co-director of the Accelerated Program.
I wasn't expecting to talk, so I apologize for my hold. So I would say that our students, sort of leaping off of the things that Mitchell was talking about, they're very focused on public health, the determinants of health. They're very social justice means a lot for them. So when they talk about career goals, they look to be leaping from the bedside into the community a lot earlier, which is a good thing because most healthcare actually takes place outside of the hospital. And I wouldn't say that it's just our younger APNN students. I would say that that's across the board. Even some of our students who are a little bit older are very community health or public health focused. So I think the determinants of health becoming sort of common language for everyone is really playing into where the students want to be. We certainly have students that are very focused on the clinical arena and going on to becoming nurse practitioners, but it's less and less of that focus and more on public health, which is great.
And I know that what I have seen from our employers recently is, talking more about hiring of new graduates into previous areas where you needed to have 1 to 2 years of experience in acute care before entering in. And, those are areas, within some of our infusion centers for the Wilmot Cancer Center, for some of the home care opportunities, and really trying to bring our new graduates into those areas sooner, and removing those barriers that you have to have 1 to 2 years experience of acute care, because many of those areas are acute care, for sure.
Yeah, absolutely.
Thanks, Lisa. Let's see. What areas within nursing, clinical care, education, research are in most need right now across URMC? I can share my thoughts about that, but I didn't know if anyone else has some ideas about that.
Why don't you start us off, Kathy, and then we can.
Sure. Okay. So, I mean, I obviously, there are vacancies in nursing across the whole system, whether that is in acute care, whether it's in critical care, in home care, and actually in long-term care. And, I think right now there is a significant need in long-term care for us to have more we're seeing many more vacancies in that area as well. I don't actually see, and maybe Mike, you can comment, as it relates to FF Thompson, one need greater than the other. I think we're seeing some vacancies across the spectrum. I know here at the medical center, they have implemented a new travel at home program where staff can really get the experience of, changing from one area where they have been focusing in and have the opportunity to work in some of the other affiliate hospitals or in other different aspects within the medical center, because of some of the needs are changing back and forth.
Yeah, our greatest need is in med surg. Our ED is pretty good, ICU is good, OR is good, OB is good, but med surg really got pummeled. And where we would normally see a lot of new grads coming out, we've seen very, very few new grads applying for med surg because they want to get into the longer residency programs and go directly into the ED ICU, as you kind of mentioned. The big problem that we're all having, and it's going to be another lingering effect of COVID is long-term care, as you mentioned. We've lost over 1,600 long-term care beds in this community alone since the beginning of COVID, and we just can't get patients out of the hospital. And now that the state put the mandated ratios in place for the nursing homes, that's only going to get worse because there was a shortage of over 45,000 long-term care health professionals before COVID, and that was in a study that the DOH commissioned out of Cornell. And, putting RNs into nursing homes, it quite frankly is too expensive. It's with how little we get paid, we can't staff up in RNs. That's why they're LPNs and CNAs, but that workforce was decimated through COVID. So there's challenges throughout. We're seeing a lot of nurses who prior to COVID probably still had a good 5-6 years left of them. They're leaving. They're just exhausted and they're retiring early, and, even some of the discussions I've had with them is, our plan was to do this. all right, we're still going to go to Florida, but we're only going to go 3 months, not 6 months. You know, they're just totally changing their plans and would rather get out earlier because of how tired they are. So huge challenge, huge impact, and we just got to do as much as we can to increase the pipeline. And then we've got the responsibility, obviously, with all of our retention initiatives.
And Mike, I should have introduced you for that. I just think everybody knows you because first of all, you've been on TV like every other day since the pandemic started.
And that's just to bug Steve Goldstein. That's the only reason.
That's right. Yes, I know. That's just to bother him. But Mike is a graduate of our leadership program many years ago, but he is the CEO of Thompson Health, which FF Thompson, which not only includes the hospital, but also a long-term care facility and home care facility as well. So thanks, Mike, for joining us today.
So,
Kathy, if I could just add another, oh, go ahead, Mike. Were you going to say something? Yeah. If I could just add another dimension to that. So, you know, when we think about education, we think about most of our graduate students are working full time. So it really has provided an opportunity for us to be responsive to their needs. And so, you know, how can we do that? We're always in constant conversation about that. So do we start class in the evening an hour later to make sure that people have time? Do we try to do more hybrid so that we're meeting face to face every other week, and so that we can, you know, give them some more flexibility? Do we need to give them flexibility with due dates on assignments? There's been an entire multiple conversations at the program director meetings around how we can think about providing an opportunity for our students to stay engaged, to stay in school, where we really want to see them see their education as a way of filling their bucket, not just being tapped out to all the demands of work. So that's something that's really affected us, and we really are thinking about that in a way that we've never needed to before. The other thing I'll just say is that even the work that our students are doing, particularly in our graduate programs, like our leadership programs, our nursing education programs, and our DNP programs, is that our students, because of the close relationship we have with our academic health center and other clinical partners, we are looking to do their work, their graduate work, their summative work, whether it's a capstone or a scholarly project, is really the work of the institution, a work of the organization. And so we have individuals like Hazel Roberts-Shaw, who's the chief nurse officer of Thompson, is working right now with one of our DNP students who's looking at creating advanced practice network for advanced practice providers, so nurse practitioners and physician's assistants outside of Strong. How are we working on priorities, strategic priorities, many of which have been exacerbated or made even more urgent by the staffing shortages as well as the pandemic. So that's another way we can augment. That's why our education mission is responding to both the individuals as well as the clinical needs in the community and in the hospitals.
I don't know if anyone that is joining us from another state or another part of New York that we haven't talked about wants to share anything with what they're seeing in their local area. So I will go back. I know Pam, Julie had asked a question related to the Nclex, and it sounds like Lisa had answered that question about when that new exam will be in place. I don't know, Lydia, if you want to talk about what we've been doing to prepare our students for that new exam.
Sure. So first of all, our entire way of approaching education is preparing them for that, to have students be actively engaged in their learning, to have students participate in small groups, to engage with their peers in looking at case studies and identifying priorities of care, to identify what the nursing discharge orders plan would be. So really to have them more in the driver's seat in terms of that. The other thing is we've instituted clinical judgment exams. So we have a corollary or co-curricular curriculum. It used to be with ATI, now it's with NurseThink and Lisa Brophy. I won't put Lisa on the spot because I know she's not feeling well. But in the APN program, they have really looked at that so that the students are getting these types of questions. And it's not, when you take the nursing licensure exam, it's also about how to take the test. So we're constantly giving them opportunities to think about the kinds of questions that they have, so they can look at the stem of the question and identify the distractor. So there's the technical aspects as well as thinking of the priorities of care. The other piece too is, I think, by virtue of increasing the experiential learning aspects. So for example, the students will go to clinical. And let's say that in clinical, there was a situation that emerged, or a skill that students were struggling with. The faculty can now work with those students and bring them back to our labs, and they can work in our learning labs using, in our skills labs using skills trainers or various case scenarios that can help them sort of go through that case again and have more practice. So the idea between increasing experiential learning, using technology to provide sample questions, as well as really fundamentally changing the way the classroom operates. Nobody can come into a classroom and just sit. They have to be engaged. And there's other technology we use to check the students' learning as they're going through. We use a gaming kind of game-based platform to help that, so that we are trying to have them prepared. The last thing I'll just mention is that because of competency-based education, it's really important, and this would be something that's for Nclex, but certainly in graduate education as well, where we are changing, or we're actually developing competency-based rubrics so that we can assess our students' learning. And that will be something that will be really helpful in preparing not only our undergraduates for the Nclex, but certainly our graduate students for their national certification exams, and others for the practice, their professional practice as a leader or as an educator as well. So those are just some of the things we're doing.
Thanks, Lydia. I know that one of our conversations that we've had with alumni, over the past year, really talked about the Future of Nursing report, and the significant emphasis in that report on the social determinants of health equity, wellness. And one of the things that we had done even prior to that Future Nursing report was really develop a whole course in the accelerated program that Lisa actually was critical in its development, was on population health. And part of that really was developing a poverty simulation that each of our accelerated students have participated in. I think we've now have done it 3 times. We'll be on to our 4th soon. I don't know, Mitchell, if you want to talk a little bit about the poverty simulation and how you really saw that was really focusing our students on incorporating a lens of social determinants of health.
Sure. So the poverty simulation is run here in Helenwood Hall, in which we transform the first floor of Helenwood Hall into a local community. And so there are service providers, there are employment opportunities, there's grocery stores, there's anything and everything you can think of that would be in a traditional community. What we do is we run a simulation where students participate, and I think it's over 15 or 20-minute blocks where they experience an entire week of what it's like to live in this community. Now they are, at the very start, they're kind of given a family that they belong to, or they might be an individual person who is kind of forced to survive for this week. But it really helps students not only read about something and then say, okay, I've internalized what this means to be in poverty, but it gives them a real life, or at least a simulated experience of what this could look like. And so once the simulation is done, there's a debrief session that happens. And the debrief, it gets very deep, it gets very emotional. I think a lot of students take away from it things that they hadn't considered before. For some, they may have already experienced homelessness or houselessness. Others may have experienced other forms of poverty. But for all students that are there, they begin to recognize that this is something that really could happen to them. This is something that has happened to some of their fellow classmates, or has happened to some of their instructors, and undoubtedly will happen to the populations that they're serving. And so it really takes it out of the theoretical framework of, oh, well, this is what poverty is, or even the windshield survey, where you would drive around through a neighborhood and kind of guess or for lack of a better terms, truly drive through experience of what a neighborhood could be. But this puts you right in the center of it. And I have to say, it's brilliantly facilitated by Aaron Baylor and help me the other person.
Tara Sawetnik.
Tara?
And yes, brilliantly facilitated. The other thing that's really important about this is something that gets the entire School of Nursing community involved. So yes, it's done for the students, but we have other folks who are working in terms of working, quote unquote, the different service providers of the different areas. There are faculty and there are staff. So it helps people to have this better contextual understanding of what it means to be living in an environment, to be in a position where you're actually in a school that's pretty privileged to have this experience, but recognize that your impact and the things that you're doing, the things that you're going to be talking about, all of that, including that language, has an impact on every single person that you encounter.
Thank you so much, Mitchell. We do have one more question that just come up in the chat that we can address before closing, and it's from Pam Thompson, Pamela Thompson. Are you going to be focusing on rural health in any of your efforts, such as the impact on care delivery design and meeting healthcare needs? So I don't know if one of you want to address that, and I can talk a little bit about the rural health NP residency program a little bit if needed. Go ahead, Lydia.
So I was just going to start with that. So one of our former faculty members, her DMP work was on developing rural health curriculum. And so I'll let Kathy talk about the residency, but it's a partnership between the School of Nursing is the academic partner of the nurse practitioner residency, and her work was used in the NP in the rural residency. But within our NP students, we've been able to bring that rural health perspective and those modules related to skills and specific things as that would be important for nurse practitioners in rural health to have. So we have looked at that from the perspective of incorporating that into our NP education. I will just say more informally, we have really tried. One of the things that's really important, and I would have included it in a priority if I could have had 4, but I didn't want to be too much, is the idea of developing expansive academic practice partnerships is critical. It's aligns perfectly with what I've been talking about with the technology and experiential learning more broadly. And in that end, we do a lot of outreach to our community across the catchment area of New York that the medical center serves in psych, across, beyond, because the psych program NP program reaches nurses throughout the state. And so in that regard, we really do try to cultivate relationships with practices that are in the rural areas so that we can do 2 things. One, put our students there, place our students there, who have an experience of what rural healthcare is about. But secondly, recruit future nursing students from those areas to our program so that they will be able to have that education to take back to their communities. So I'll let you talk about the residency, Kathy.
Yeah, I'll just talk very briefly that Highland Family Medicine, which is one of the primary care practices as part of the U of R primary care network, has had a HRSA grant for several years to educate nurse practitioner residents, those that have already graduated from an NP program. And the first aspect of the NP residency program focused on urban health. And those nurse practitioner residents really were part of the Highland Family Medicine that is here in Rochester. We then applied for a second HRSA grant that expanded that to have a rural health component. So now we have NP residents that are in or at Highland Family Medicine here in Rochester, but then we're also working with Tri-County in the rural areas that's down by the Dansville, Bath area to have NP rural residents in that area as well. So that really has just unfolded in the last year or so. Good question though. So I know we are at the end of our time, and Jessica, you were going to show us a slide about how we can continue to be engaged as we move forward with our alumni as well. Yes, so I really do want to thank all of you for attending and really helping us to think through. And I thank you, those that are participating that I called on today. I really thank you for participating. And so there are definitely some, key ways to remain involved with us, attend virtual and in-person events. We are going to continue to hold virtual events. We have been able to really garner relationships more with those that we would never have been in contact with if we were doing everything in person. Obviously, consider making a gift in support of the scholarships, our research fund, Helen Woodhull expansion, volunteering on your reunion committee as a mentor. And the one I really want to focus on is really join our Meliora Collective, which is an opportunity to really be able to work one-on-one with students and faculty to really become mentors and, sharing your expertise and experience with them. And we have been holding our Honor Our Nurses campaign, which is a joint initiative between the School of Nursing and the University of Rochester nurses across our system. To really be able to focus and honor them. We were unable to do anything related to the World Health Organization campaign for nurses and midwives because of the pandemic. And so we've refocused our efforts on Honor Our Nurses campaign. And we would love for you to go to our website and consider becoming involved in that campaign, recognizing a nurse that might have made a difference in your life. So I think that we are at time. I do want to thank you. I said one of the chats just are encouraging us to continue the virtual opportunities, that she lives in California and has been able to reconnect with school nursing through these events. And it has been a pleasure being able to connect with our alumni across the states. And we absolutely are committed to continuing to doing these virtual events. So thank all of you for coming and enjoy spring heading into some summertime. And I hope you're able to take some time for yourselves and take care of yourselves and stay well. Thank you.